This time, I would like to present the moderator for our morning sessions, Dr. Matthias Maiwald from Singapore. Dr. Maiwald is Senior Consultant in Microbiology and the Head of Service at the KK Women's and Children's Hospital, and is an Adjunct Associate Professor at the Department of Microbiology and Senior Consultant in Microbiology, National University of Singapore, and at Duke National University of Singapore Graduate Medical School. Dr. Maiwald, you have the floor. Thank you.
Thank you so much for the introduction, Kevin. I would like to present some background to the Singapore situation. The background is that Singapore was hit quite badly by the 2003 SARS outbreak. Singapore had 238 cases, 33 deaths, and among the deaths were 5 deaths among healthcare workers. And Singapore learned a painful lesson. Due to its exposed location as a trade and travel hub, Singapore is extremely vulnerable to imported infections. And that led Singapore to implement a whole range of preventative measures aimed at combating pandemics that would arise. Singapore had one fortuitous event in the year 2019 before the COVID pandemic arose, which is that the Singapore National Center for Infectious Diseases, or NCID, opened up. It is a purpose-built medical facility within the public healthcare system. It has 17 wards, 330 beds, and 2 ICUs. And it has a high-level isolation ward capable of handling Ebola, Marburg, and anthrax. And it has research and diagnostic facilities, and it houses the National Public Health Laboratory. It wasn't planned, but fortuitously, it opened up in September 2019, just in time to the COVID pandemic. I would like to present an overview of the Singapore COVID situation. Singapore is a tropical city-state with a population of about 5.5 million. And Singapore, as of 9th September 2022, reached about 1.8 million cases and about 1,600 total deaths. And this is a comparatively very low rate of 0.09% of death rate due to COVID. Currently, as of 9th September, 239 patients were hospitalized, 12 required oxygen supplementation, and 9 patients were in ICU. This is an overview of the Singapore COVID cases so far. On the top of the graph, you see the cumulative number of cases up to now. You can see a climb relatively recently, which is in 2022. And on the bottom, you see the different waves of COVID cases. So we start in 2020, and around April, May, we had an outbreak in foreign worker dormitories. These are dormitories which are inhabited by a relatively large number of foreign workers, mainly from the construction industries. And in these dormitories, COVID-19 spread quite rapidly. Then, if we look at 2021, we had an airport cluster and healthcare clusters, which got Singapore to tighten its measures. And then late 2021, Singapore experienced the Delta wave, and in the Delta wave, Singapore had a relatively high death rate relative to Singapore's usually low death rates. And in 2022, Singapore saw the arrival of the Omicron variant, and you see that in March and then again around July, August, we had peaks which were caused by the Omicron variants. And the genomic surveillance results are available up to July 2022. So the local and imported COVID-19 cases were all Omicron. 70 to 71% were BA5, 26 to 27% were BA2 and its lineages, and 2 to 4% were BA4, but all Omicron. This slide shows you the Singapore vaccination status. So on the top, you see the cumulative numbers of vaccines. So the light green shaded areas are the areas where people received the first vaccination dose. Then the dark green area is the number of people who received both doses to be fully vaccinated, to be considered fully vaccinated. The vaccines under the National Vaccination Program are the Pfizer or BioNTech vaccine, the Moderna vaccine, the Novavax vaccine, and the Sinovac CoronaVac vaccine, which is an inactivated vaccine from China. So the current situation is 93% of the total population received at least one dose, 96% of eligible population completed the full regime, and 79% of the total population received booster shots. And people eligible for the vaccine in Singapore for the primary series, persons aged 5 years and above. For the first booster, person aged 12 years and above. And for the second booster, it is strongly recommended that persons 60 years and above receive it, or people living in aged care facilities, or medically vulnerable persons, or persons aged 50 to 59 years by choice. So the current pandemic measures in Singapore as of September 2022 are relatively light. Singapore had comparatively strict pandemic measures 2020 through to the first half of 2022. So it stood out among the countries for having relatively strict measures. But the year 2022 saw a stepwise loosening of measures. Currently, the public measures are such that mandatory mask wearing is only required for healthcare facilities, for public transportation and taxis. There are no more group size limits for gatherings. There are no more vaccination differentiated measures except for group sizes greater 500 and for certain food and beverage establishments, etc. And no more safe distancing requirements, and all employees may return to the workplace. Travel returned to nearly normal by September 2022, and travelers less or equal than 12 years old or fully vaccinated travelers may enter Singapore without testing or quarantine, and not fully vaccinated travelers need a pre-departure test and a COVID-19 covering travel insurance. In healthcare establishments, there is mandatory mask wearing and still some limitations to the numbers of visitors. So we go on to the first session. We will have Dr. Ziad Al-Ali, who gives us an overview of long COVID. We have Professor Imogen Mitchell from Australia with Australia's experience of COVID-19 workplace safety. We have Professor Lydia Moravska from Australia talking about airborne infection. We have Professor Neil Brusselars talking about the evaluation of science advice during the COVID-19 pandemic in Sweden. We have Professor Laith Jamal Abul Radad talking about the immune protection of COVID-19 vaccination and natural infection. And we will have Professor Eike Steinmann from Germany talking about transmission and inactivation of SARS-CoV-2. And this is followed by a lunch break.